the illustrious Mike Stagg is here today to talk to us about first aid.
I don't know if it's so illustrious, but
You're illustrious.
we'll do what we can. So first aid, really, first aid's a huge subject, right? Lots of stuff goes into first aid. Really want to preface this right off the bat is this shouldn't be a substitute for any kind of formal first aid type training, right? This is a 35,000 foot hit you in the face with it for a half an hour type stuff. Just hopefully some really good information that you can take back, and if there is a situation in the workplace, you can think back and think, oh, you know what, we learned a little bit about that in the webinar. So don't take this as a 30-minute crash course to first aid. Let's make sure that if you're interested in this kind of stuff, that you make sure you get some formal training on it. There is an OSHA standard that goes along with first aid. 29 CFR 1910-151. There's the citation, but what it basically says is if you're working in a workplace and it's not a clinic setting, right? It's not a hospital or something like that. There's not an on-site safety clinic. Then you have to have a person or people who are trained and adequately equipped to render first aid, and that there is an adequate first aid kit available. So as an OSHA requirement, right? Because anytime you see shall in OSHA speak, shall means must. So you have to get this stuff done. You have to have somebody who's trained in first aid and that you have an adequately stocked first aid kit. So what does that mean? So let's talk about first aid real quick. And what is the most important rule of first aid? So the most important rule number one is always protect yourself first. Make sure the scene is safe for you to go in and help somebody. Because as selfish as it sounds, your life is always more important than somebody else's, okay? Don't go, so say you're a roads crew and you're out in the street and you have your retroreflective vest on and everything's working okay. But then you have somebody who plows through and one of your coworkers gets hit by a car. But as that coworker gets hit by a car, you notice that and you're going to go run out there to help this person because they obviously need help. But there's still cars zipping around and you haven't started traffic control yet. Okay, scene's not safe yet. Don't go and help this person until the scene becomes safe. So make sure that the scene is safe before you go in and start to help somebody. Also, be aware of the surroundings because sometimes things aren't always as they seem. And sometimes if the scene is safe now, it may not be safe later. Okay, so make sure that you're keeping aware of your surroundings and your situations, even when you're providing aid, and even if the scene was safe at first for you to go into, because sometimes it can deteriorate, other things can happen. So make sure that you keep aware of your surroundings, because if at any time it becomes unsafe, get out. If you've already started providing care to somebody, get them out with you. But if you haven't yet started providing care yet, make sure that the scene is safe before you start to do that. Okay, there are a lot of different first aid type of injuries: bleeding, shock, burns, wounds, choking, fractures, heart attacks, strokes, bites and stings. We'll go through all of these. We'll hit it really quick because I know we don't have a lot of time. But again, these are very, very important things. We want to give you just some basics, something to whet the appetite. And then hopefully you'll be able to go out and get some more formal first aid CPR type training in the future. So what is first aid? The definition of first aid is the immediate care given to somebody who is injured or severely ill. Okay, so there's our definition of first aid. But it does not replace proper medical treatment. Okay, so something like putting on a Band-Aid, is that first aid? Yeah, that's first aid. You're applying help to somebody who is injured. Okay, does that replace proper medical treatment? Maybe, right? Putting on a Band-Aid, sure. But other situations, you are the first responder, right? A severe bleeding, an unconsciousness, a broken bone, okay? You're providing the immediate care before advanced medical personnel come. So just because you've started the care doesn't mean that they might not need medical treatment afterwards. So what we're doing here with first aid is we're first ones on the scene and applying aid as soon as possible, okay? What that means is you've got, anytime you're going to perform first aid, you've got to be sure that you obtain consent from somebody. What consent means is that you introduce yourself. Hi, my name is Mike. I'm certified in first aid. Can I help you? Okay. Something as simple as that. You're gaining consent from the person to help them in their emergency situation. Okay. Now they can say yes, and then you can go and start to help them, or they can refuse your care. If somebody if you've asked for somebody's consent and they start to refuse your care, say, nah, I don't want your help, it's okay. What you do then is you make sure that you just explain to them, I see that you're bleeding pretty bad here. All I'm going to do is I'm going to do this, I'm going to do that, I'm going to help you. Can I help you? Okay, so make sure if you've tried to gain consent from somebody and they at first refuse your care and you notice, I really need to help this person. Okay, just explain what you're going to do. Explain, this is what I'm going to do, this is how I'm trained, and then try and get consent again. Once you have their consent, then you can help them. There's also something called implied consent. What implied consent means is that if a person is unconscious or is otherwise non-responsive, and you tried to gain consent from them and they don't give you consent because they physically cannot, then consent is implied. Okay, then it's like, yeah, you can go ahead and help me so you can save my life. So you have consent and implied consent. And what this does, once you gain consent from somebody, you are then protected under what's called a Good Samaritan law. So a good Samaritan laws state that as long as you're providing aid or providing care to the best of your ability and to the amount of training that you've been trained to do, you're covered under this Good Samaritan law that says they can't come back and say, hey, you did something wrong, or you helped me when I didn't want help. Okay, as long as you've taken the proper steps to gain consent and then gave care according to the level of your training and to the best of your ability, you're covered under a Good Samaritan law. So don't feel apprehensive about going to help somebody in case they need help. Okay, because you're covered. You're covered under this Good Samaritan law. So just go and help somebody. It's okay, right? You'll be covered. Everything's good as long as you provide care to the level to which you've been trained to do. So when should we call 911? So after we've gained consent, we've gotten their consent to go and help them. We've assessed the situation, that we assess that it's safe and it's okay for us to go in and help. Now we're making the determination, when are we going to call 911? So 911, anytime somebody is unconscious or they lose consciousness after they were conscious, immediately call 911. If they're not breathing, if they don't have a pulse, call 911. Severe bleeding, major injuries, something like a compound open fractures, okay? Those things, major injuries, anything involving an eye, make sure you call 911. Spinal or head injuries, amputations, suspicions of a stroke, make sure that those things have 911 call, because those are life-threatening situations. We want advanced medical personnel there as quickly as possible. So let's make sure that, after we've gained consent, we've checked the scene and made sure it's safe, we then make a quick assessment and say, do we need to call 911? If we do, let's make that call right now before we start to provide care. Okay. And then what we do is we want to make sure we put on our personal protective equipment. We want to make sure we protect ourselves from these blood-borne pathogens. Okay. So what are blood-borne pathogens? Blood-borne pathogens are microorganisms, they're viruses, bacteria, something that causes disease in your blood. Okay. Good rule of thumb, if it's wet and warm and it's not yours, don't touch it. Okay, at least without gloves. Okay, make sure you have gloves on, make sure you have your proper precautions on. Gloves, mask, goggles, smock if you need it, okay, to protect yourself from other people. Because blood is a very, very dangerous thing. Okay, just one drop of blood, just this drop of blood you see on your screen here, can contain a bunch of different hazards. Okay, they're all invisible. You can't tell what's going on here. Okay, you don't know what nasty stuff this person has. You want to make sure you protect yourself. Make sure you use your personal protective equipment. There's also other potentially infectious materials, things like bodily fluids, like saliva, fluids in the blood, organs, tissues. Okay, all those things are potentially infectious things, potentially infectious materials. So what are we worried about with bloodborne pathogens then? What kind of diseases? Things like HIV and AIDS, hepatitis B, hepatitis C, and others like syphilis and malaria and relapsing fever, all sorts of different things that we're worried about that could be living in that one little drop of blood. From this list here, though, which one do you think we should be most worried about, most concerned about? It's hepatitis C, right? Hepatitis C is a silent killer. It's the assassin of the bloodborne pathogen, right? It's undetectable. There's no test for it. There's no vaccine for it. Excuse me. Okay. You can live a long time with hepatitis C being dormant in your blood and not know you have it. Hepatitis C also lives a long time on surfaces in open air before the bacteria becomes inert. So you have to make sure that you're protecting yourself against bloodborne pathogens, right? Hepatitis C is a huge, huge thing just because it lives for so long outside of the body and you can not know that you're infected by it. So make sure that you apply your PPE and you use it, okay? Because it is your last line of defense. Make sure you wear your gloves. Make sure you wear gloves anytime you're going to touch something that's warm, wet, and not yours, okay? Make sure you have that PPE on. Okay, so what do we do now? We've assessed the situation. The scene is safe for us to go in. We've called 911 if we needed to. We've put on our PPE. Now we're going to assess the patient. Okay, first thing we didn't want to do is check for consciousness. Get by the person and make sure you, hey, are you okay? Tap them on the shoulder. Hey, are you okay? Are you okay? If they respond to you, they're obviously conscious. Okay, if they don't respond to you, they're going to be unconscious, and that's a life-threatening condition. What this assessment does, this quick assessment, helps to identify these life-threatening conditions. If the victim is responsive, they should be able to tell you what's wrong. They should be able to tell you who they are. Okay, what you want to assess here in this situation is their level of consciousness. Do they know who they are? Do they know where they're at? Do they know what happened before the injury? Okay, all these things, these questions that you're asking them is really going to steer where you're going to take their care. Okay, then do a quick head to toe exam. Start from their head, work all the way down their body, looking at all their limbs, and looking for obvious deformities, pooling of fluids, things like that. Make sure you assess the patient and make sure the determination, do I need to call 911? Is it one of these life-threatening things we talked about? Are they breathing? If they answer you, they're breathing and they have a pulse. If they don't answer you, they may not be. Anytime you find someone to be unconscious, severe bleeding, that big long list, make sure you call 911. So we need to get advanced medical personnel there as quickly as possible. After you've assessed the person and determined what's going on and what kind of aid I need to provide, then you give it. Give your aid, okay? Make sure you don't go beyond your training. Don't go beyond the training that you have been provided, because at that point, if you go beyond that, then you go beyond your scope of practice. And that's where you could get into trouble. So make sure you give aid according to whatever your training is. Do your best, right? Always give your best with what you have available to you. Do the best of your ability, because then you're protected under those Good Samaritan laws. In a former life, I was an aquatics director. I'm a recreation director. Yeah, even before that, I was a lifeguard. And so as a lifeguard, we're trained in a certain area of first aid up to a certain level of care. Well, during that time that I was a lifeguard, I was also an athletic trainer. I worked with the University of Utah football team, and so for a number of years. And so, for example, I know how to relocate a joint, a shoulder that's been dislocated, for example. And so as I'm working as an aquatics director, I see one of our patrons goes off our diving board, dives in, and he comes up out of the water, and he runs over to the first aid tent, and he's obviously got a dislocated shoulder. You can clearly tell that his shoulder is out of joint. So I'm thinking to myself, okay, as an athletic trainer, I know how to put this joint back into socket. I know how to relocate this joint for him. At that point, though, when I was working at that point as a lifeguard, my lifeguard certification says I don't know how to do that. Okay, so make sure you just do up to whatever your training is, okay, in the situation that you're working in, so that you don't get caught in these Good Samaritan laws and things like that. So again, just make sure, don't go beyond your training and do your best with what you have available to you. Okay, Let's talk about bleeding and bleeding control. First thing to do if somebody's bleeding, okay, you've gained your consent, you've put on your PPE, you've done all these things. Now we're into care, right? Bleeding control, first thing, direct pressure. Take a clean sterile dressing, something like a gauze pad, a roller bandage. If you don't have those things available to you in a first aid kit, or you're out somewhere and those things aren't available, a shirt, a ripped off pair of pants, a sock even if you need to, right? Just something that can help you apply direct pressure to whatever wound that is so you can control the bleeding. It's important to know though that don't remove whatever piece of clothing, whatever piece of garment or cloth that you put on this wound. If it starts to soak through, don't remove it, okay? Because what happens is as you're applying direct pressure and it starts to soak into that, the blood starts to clot. And if you were to look down at that dressing and think, oh my goodness, we're bleeding through, let's do something different. Let me pull that off. As soon as you pull that cloth off, you pull that clot out and it starts to bleed all over again. Okay, so direct pressure to slow the flow of blood, and then elevate that limb above the heart. Elevate that piece of body above the heart if you can, because what that's going to do is it's going to pull the blood away from that area, okay, back towards the core, back to the center of your body, and help control the bleeding. Another very, very important thing, especially in any kind of first aid situation, is to treat for shock. Shock is a condition where there's insufficient amount of oxygenated blood flowing to the brain because of blood loss or injury. Okay. What anyone can do, anyone can care for shock. It's very, very simple. Have the person lay down on their back, raise their feet up, put their feet up on a chair, or just elevate their legs above their heart, and cover them with the blankets to minimize heat loss. Okay. So shock is a huge medical concern, right? Somebody cuts themselves, they're bleeding, they could go into shock. You know they're going into shock because they go pale, right? They turn white as a ghost. They start to get clammy. They start to not make sense with what they're trying to tell you. So make sure you treat for shock, lay them down, elevate their feet, lay them on their back, raise their legs up so that their blood then flows back into the core of their body, back and can pump oxygenated blood to their brain. What about burns? Okay, there's 3 different types of burns. You have a 1st-degree burn, 2nd-degree burn, and a 3rd-degree burn. Everyone here on this webinar, I'm sure you've had a 1st-degree burn, right? If you've had a sunburn, you've had a 1st-degree burn. Okay, if you look like me, you've had lots of 1st-degree burns. Or you have a 2nd-degree burn. 2nd-degree burns is a burn that blisters. Okay, some of us have had those. Then you have your 3rd-degree burns. 3rd-degree burns, it's a piece of flesh is completely charred away. Okay, just blackened, gone. Okay, 1st and 2nd-degree burns are very, very painful. They can be very, very painful. A 3rd-degree burn, for the most part, there is no pain associated with a 3rd-degree burn. Now, why is that? That's because when you suffer a 3rd-degree burn, you've burned all the nerve endings, so you can't feel it anymore. Even though it's incredibly dangerous and it's life-threatening, it doesn't hurt, right? So with the 1st and 2nd-degree burn, what we want to do to take care of that, immerse it or flush it with cold water. Okay, 3rd-degree burn, you don't want to do that. Do not flush a 3rd-degree burn with water. Why? Yeah, you got charred skin on there. You start to flush it with water, it just starts to come off. Okay, and that's not what we want. Okay, so 1st and 2nd-degree burns, wash it with cool and cold water, and then wrap it loosely in a sterile dressing. So why do we wrap it loosely and not tight? We don't want to wrap it tight because you want that burn to be able to breathe. You want the heat to be able to dissipate off of the skin. So make sure you wrap it very, very loosely. What you're trying to do is just keep it clean and from not getting infected. Okay, same thing with a 3rd-degree burn. 3rd-degree burn, you don't rinse it, but you want to wrap it. You want to wrap it nice and you want to wrap it loosely so that it stays clean, and make sure you call 911. 3rd-degree burns are a life-threatening situation. Make sure you call 911 for a 3rd-degree burn. Okay, what about choking? So there are 2 different kinds. You think of choking as someone clearing their throat and saying, help me, I'm choking, I can't breathe. Okay, if they can cry, cough, speak, or breathe, they are not choking. They're not in respiratory arrest. They're in what we call respiratory distress. So respiratory distress, they can still make some kind of a noise. If you notice that somebody's in respiratory distress, they can't make noise, they're clearing their throat a lot, they're telling you they're choking, they have something caught in their throat, encourage this person to cough. Don't touch this person. Don't do anything to this person like back blows or anything like that. Encourage them to cough. Okay? Cough, cough, cough. Tell them to keep coughing until either one, the object comes out, or two, they are now no longer to make noise. And then they universal sign of choking. Okay? If they're not able to make noise anymore, then they're in what we call respiratory arrest. At that point, what you want to do is you want to give them 5 abdominal thrusts and 5 back blows. Okay, we can't call it the Heimlich maneuver anymore because we called it the Heimlich maneuver for a number of years, and the Heimlich family wanted like $1 million or something like that. And so now you just call it the abdominal thrust. So what you do for abdominal thrust for somebody who is choking, take your hand, make a fist, take your thumb here and poke out, take your thumb, tuck it inside and poke out that first joint right there. You got that first joint poked out. You take that joint, that point, you reach around your person, you find their belly button. You put that point right above their belly button. Then you 5 abdominal thrusts, 1, 2, 3, 4, 5. After you've done 5 abdominal thrusts, lean them forward and give 5 back blows right between the shoulder blades. Each abdominal thrust and each back blow is a direct, concerted attempt to get whatever is in their airway out. So what does that mean? You gotta thrust hard and you gotta hit hard. Okay, so make sure that you do that with force. This isn't something you want to practice on your partner on your buddy sitting next to you though. Okay, this is something where you can practice getting into a position, but don't really do this unless you're doing it on somebody who is really choking. Okay, what about a fracture? Fracture signs and symptoms, obvious disformity, something doesn't look right, something hurts somebody really bad. They might come and tell you that I have a fracture. Okay, some of these can be life-threatening. If you fracture a femur, for example, the upper part of your leg between your knee and your hip, okay, that is a life-threatening situation. Okay, you fracture a hip, that's a life-threatening situation. You fracture your back, skull fractures, life-threatening situations. Okay, make sure you keep the victim still. Make sure you call 911 and isolate the limb. What that means is that usually when somebody hurts themselves and they have a fracture of some kind, they're going to come up to you. You're going to notice, and they're going to be holding their arm, their leg, whatever, in a position that feels comfortable for them. Okay, that might take away some of the pain. Leave them in that position to where that you find them. Don't go manipulate the joint and say, is it really broken? Or are you just faking it? Leave them in the position that you found them in so that you can call 911 and then provide care as needed. Okay, heart attack. Look for signs and symptoms of a heart attack. What are they? Pain in the left shoulder that radiates down the arm. Okay, shortness of breath or not able to catch your breath. Tightness in the chest. Okay, those are all signs and symptoms of a heart attack. Sweating profusely, being disoriented. If you notice this from somebody or somebody's telling you these things, you notice this in yourself, make sure you call 911. If this person is conscious, make sure they stay conscious. Okay, that means that's what you're doing by monitoring them. Make sure that they're comfortable. Sit them down in a chair. Make sure they're comfortable. If you need to, lay them down and elevate their feet. Treat for shock. But if they all of a sudden, if they go out cold, check their ABCs, airway, breathing, circulation. Check their airway. Make sure they can still breathe. Check their breathing. Are they breathing? Do they have a pulse? Okay, start CPR if you've been trained. And then above all else, even if you have never been trained on it, use an AED, an automated external defibrillator. The purpose of CPR, right, is to just circulate oxygenated blood throughout the body. The purpose of an AED is to reset the heart. Okay, so if somebody's had a heart attack, the AED sends an electrical shock through the heart that resets it and starts it working again. AEDs are pretty much idiot proof, right? You turn it on and you listen to it. It tells you everything to do. So even if you've never been trained on it, even if you think, oh my gosh, this thing intimidates me, this machine, it's going to shock, it's going to do all these things, don't be intimidated by it. It tells you everything to do. Have an AED available to you. We absolutely recommend that all facilities have AEDs and that they are able to take care of people in case of an emergency. All right, what about stroke? Signs and symptoms of a stroke. Think fast, F-A-S-T, fast. Face. What you want to do is have this person smile. If they can smile and one side of their face droops down, sign and symptom of a stroke. Have them raise their arms up. They raise their arms up and one arm is higher than the other, sign and symptom of a stroke. Okay, notice the time. Note the time that all this happens. If you suspect somebody's had a stroke, they're slurring their words, their face looks weird, then you try these things, make sure you call 911. What about bites and stings and allergic reactions? Okay, bites and stings and allergic reactions. A lot of this depends on the person, depends on the type of bite or the type of sting. Okay, in case of like a bee sting, for example, check for a stinger, check for swelling. If you see a stinger, go ahead and remove that, but don't use a pair of tweezers, right? Don't use a pair of tweezers. You use a pair of tweezers to remove a bee sting. The venom sac's still attached there. As soon as you squeeze down on that to remove that, it's going to squeeze the venom in, make it hurt worse, and you could have a more severe reaction to that. Use a credit card or something to get that off. Wash it with soap and water and apply an ice pack to just ease some of their pain. First aid kits, really quick. Everyone close your eyes. Everyone close your eyes. Point to your nearest first aid kit. Okay, open your eyes. If you're in a room of people, is everyone pointing at the same first aid kit? Okay, know where your first aid kit's at. Make sure it's accessible and you keep it stocked. A great best practice is to have regular inspections of that first aid kit. Make sure that there's still Band-Aids and alcohol pads and gauze pads and roller bandages and everything that needs to be inside of that first aid kit. If you're a mobile workforce and you're a parks crew or a streets crew and you drive around in your truck all the time, make sure that you have a portable first aid kit inside of your truck. Just a pocket first aid kit inside of your glove box or inside of your center console of your truck so you can get to it when you need to. All right, what about medications? It's very, very important that you never give anything to an unconscious victim. We as employers, we want to make sure that we don't give medications to anybody, right? Don't give any medications to anybody, okay, except handing a victim's heart pills to them. You can hand somebody their heart medication, say, here, take it. You can tell somebody, hey, here's where the acetaminophen is, here's where the Tylenol is, or here's where the ibuprofen is. We shouldn't be giving it to them. Here, take some ibuprofen. Here, take some Tylenol. What you should do, you can tell them where it's at. It's over there. You can go take it. Read the bottle, read the label, go take it. But we shouldn't be administering any kind of medication to anybody. We just don't know what this person's body type is like. We don't know how fast they metabolize things. Okay. We had there's a question about allergic reactions and giving Benadryl, right? We shouldn't give Benadryl for allergic reactions. We can give it to the person and say, here's the Benadryl, have them take it, but we shouldn't administer any kind of medications, including over-the-counter stuff, okay? If you're injured, make sure you report it. Report all your injuries, no matter how severe they are, and make sure that it's done immediately. Immediate reporting to your supervisor of any kind of injuries. Okay, so I know that was a huge crash course, no pun intended, on first aid, but I think it was very, very important that we go through just some of these things, right? Number one is just make sure that you protect yourself first. Make sure you stay safe. Determine if 911 needs to be called. And if it does, unconsciousness, severe bleeding, no breathing, no pulse, severe fractures, those things, head, neck, or back injury, make sure you call 911. Use your universal precautions. If it's wet, if it's warm, and it's not yours, don't touch it. Make sure you have your PPE on. Use your personal protective equipment. Okay. Do we have any questions?
We don't have any questions in the chat box yet, folks. If you got questions, type those into the chat box and Mike would be happy to answer those right now. Important subject. Way to go, covering a lot of material quickly. That's a crash course for sure.
It's a crash course, yeah. But like I said at the beginning, I mean, this is not to take the place of a regular first aid course. I mean, we absolutely recommend that you have first aid and CPR training. Get with a local fire department or a local police department or a recreation center in your area who has staffed lifeguards. A lot of these places have trainers. They have monthly classes. Fire departments, they hold free community classes, right? Get in there, get trained. This stuff will save lives. It could save your life. It could save a friend or a coworker's life. It could save a family member's life. So we absolutely encourage you to get trained in first aid and CPR when you have the ability to do so.
then you have the confidence to go ahead and do something. And that's probably the most important thing is being ready to take some action there. Well, that was a great speech on that. And I don't see any more questions coming in. So you must have answered them all. So
go out and have a safe day.